Welcome back. Your license, your future, all of it comes down to questions like these. 30 high-yield Nclex challenges pulled straight from our Clinique RNQ bank, where one mistake could be the difference between passing and failing. Ready to test yourself? Question 1. Priority Assessment, ABC. The nurse receives a report on 4 clients. Which client should the nurse assess first? 1. A client with pneumonia and a fever of 101.8 degrees Fahrenheit 38.8 degrees Celsius requesting a blanket. 2. A client 2 days post-appendectomy reporting incisional pain of 7 out of 10. 3. A client with heart failure who has crackles in the lungs and an oxygen saturation of 90% on room air. 4. A client with diabetes mellitus scheduled for discharge who needs insulin teaching. The correct answer is 3. A client with heart failure who has crackles in the lungs and an oxygen saturation of 90% on room air. Rationale: this client is experiencing hypoxemia, SpO2 90%, and fluid volume overload, crackles, indicating a severe breathing problem. This is an immediate threat to life and takes priority based on the ABC principle. Incorrect options: 1. The fever is a mild, expected finding and not an immediate life threat. 2. While pain management is important, pain, 7 out of 10, is a comfort issue and not a life-threatening emergency. 4. Discharge teaching is a low-priority intervention compared to a client with an acute physiological need. Clinique RN Test A tip: when prioritizing, always choose the client with the most critical unstable vital sign or a symptom related to the airway or breathing. Question 2. Critical change. A client who underwent a thyroidectomy 12 hours ago reports a tingling sensation around the mouth and fingertips. The nurse observes a positive Chvostek sign. The nurse's priority intervention is to 1. Administer a prescribed PRN analgesic for muscle spasms. 2. Reorient the client to the time and place. 3. Administer an IV calcium gluconate bolus. 4. Encourage the client to drink a full glass of milk. The correct answer is 3. Administer an IV calcium gluconate bolus. Rationale: tingling, paresthesia, and a positive Chvostek sign, facial twitching upon tapping, are classic signs of hypocalcemia, a serious complication following thyroidectomy due to possible damage to the parathyroid glands. Severe hypocalcemia can rapidly lead to laryngeal spasm and airway compromise, requiring immediate treatment with IV calcium. Incorrect options: 1. The symptoms are due to hypocalcemia, not pain. An analgesic will not treat the underlying cause. 2. The client's symptoms are physical, not cognitive, so reorientation is irrelevant. 4. Oral calcium takes too long to be absorbed and will not address the acute, life-threatening nature of the hypocalcemia. Clinique RN Test A tip: post-thyroidectomy, always watch for signs of low calcium. The Nclex will often test the immediate, definitive treatment for acute hypocalcemia, which is IV calcium. Question 3. Infection control. A client is admitted to the medical surgical unit with suspected tuberculosis, TB. Which type of isolation should the nurse implement? 1. Standard precautions. 2. Droplet precautions. 3. Contact precautions. 4. Airborne precautions. The correct answer is 4. Airborne precautions. Rationale: tuberculosis is transmitted via airborne droplets, tiny particles that remain suspended in the air. Airborne precautions require the client to be placed in a negative pressure room and a healthcare worker to wear an N95 respirator mask. Incorrect options: 1. Standard precautions are used for all clients. 2. Droplet precautions, surgical mask, are for illnesses transmitted by larger droplets, example, influenza, meningitis. 3. Contact precautions, gown and gloves, are for illnesses transmitted by direct or indirect contact, example, difficile, MRSA. Clinique RN Test A tip: Remember the classic airborne illnesses: measles, tuberculosis, varicella, chickenpox, or disseminated herpes zoster. Question 4. Delegation. The registered nurse, RN, is planning care for 4 clients. Which task is appropriate to delegate to the unlicensed assistive personnel, UAP? 1. Obtaining a blood pressure reading on a client who is 30 minutes post-procedure. 2. Instructing a client on the proper use of an incentive spirometer. 3. Assessing a client's lung sounds prior to administering a diuretic. 4. Collecting a sterile urine specimen from an indwelling catheter. The correct answer is 4. Collecting a sterile urine specimen from an indwelling catheter. Rationale: collecting a specimen, even a sterile one, is a routine procedure that falls within the scope of practice for a UAP, provided they have been trained and the facility policy allows it. This task is not part of the nursing assessment. Incorrect options. 1. The client is post-procedure, making their condition potentially unstable. Obtaining the initial post-procedure vital sign assessment is the RN's responsibility. 2. Client teaching and instruction are part of the nursing process and must be performed by the RN. 3. Assessment is a core component of the nursing process and cannot be delegated. Clinique RN Test A Tip. RNs cannot delegate the 5 steps of the nursing process: assessment, diagnosis, planning, implementation, evaluation, or tasks requiring professional judgment, teaching unstable clients. Question 5. Ethical/legal. A client who is scheduled for an urgent appendectomy refuses to sign the consent form, stating, "I don't believe in surgery." The nurse's first action should be to 1. Notify the healthcare provider of the client's refusal. 2. Explain the risks of not having the surgery. 3. Document the client's refusal in the chart. 4. Witness the client signing the refusal form. The correct answer: 1. Notify the healthcare provider of the client's refusal. Rationale: consent for surgery is the responsibility of the provider, not the nurse. The client has the right to refuse treatment. The nurse's first and most immediate action is to inform the surgeon, the provider responsible for the procedure, so they can address the client's concerns or adjust the plan of care. Incorrect options. 2. Explaining risks falls under informed consent, which is the provider's responsibility. The nurse's role is to ensure the client understands the information provided by the provider. 3 and 4. Documentation and obtaining a signature are necessary, but they occur after the nurse has escalated the urgent situation to the physician. Clinique RN Test A Tip. In ethical/legal questions, remember that the provider is responsible for informed consent and explaining diagnosis/treatment. The nurse is responsible for verifying, understanding, and advocating for the client's rights, including the right to refuse. Question 6. Restraints. A client placed in wrist restraints is calm, but repeatedly attempts to pull out their IV line. Which action is the most appropriate for the nurse to take? 1. Release the restraints and place the client's arms under the bed sheet. 2. Continue the restraints and document the hourly neurovascular checks. 3. Remove the restraints one at a time to perform a range of motion, ROM, exercises. 4. Secure the foreline with an appropriate covering and obtain an order to discontinue the restraints. The correct answer is 3. Remove the restraints one at a time to perform a range of motion, ROM, exercises. Rationale: restraints must be removed at least every 2 hours, one at a time, to allow for ROM exercises and skin integrity assessment. This is a mandatory safety intervention to prevent complications like joint stiffness, muscle atrophy, and pressure injury. Incorrect options. 1. The client is still attempting to pull out the IV, so removing restraints would be unsafe. 2. Neurovascular checks are necessary, but do not replace the physical removal for ROM and skin checks. 4. The nurse can secure the IV, but the primary legal and safety mandate is the scheduled removal for ROM/assessment. Clinique RN Test A Tip. When answering restraint questions, think about the mandated safety checks. Q1H checks, neurovascular, circulation, skin, and Q2H removal, skin care, ROM, repositioning. Question 7. Fluid or electrolyte priority. The nurse reviews the lab results for a client with persistent vomiting. Which result is the highest priority to report? 1. Potassium, K+, 2.9 milliequivalent/L. 2. Sodium, Na+, 138 milliequivalent/L. 3. Glucose, 110 milligrams per deciliter. 4. Hemoglobin, 13G/DL. The correct answer is 1. Potassium, K+, 2.9 milliequivalent/L. Rationale. The normal range for potassium, K+, is 3.5 to 5.0 milliequivalent/L. A level of 2.9 milliequivalent/L is critically low. Hypokalemia. Hypokalemia can cause life-threatening cardiac dysrhythmias, PVCs, VTach, VFib, and muscle weakness, making it the highest priority. Vomiting often causes a loss of potassium. Incorrect options 2, 3, and 4. Sodium, glucose, and hemoglobin are all within the normal or acceptable range and do not indicate an immediate life threat. Clinique RN test day tip. When in doubt about labs, always prioritize a low potassium or low calcium level. These are the most likely to cause a fatal cardiac or respiratory event. Question 8. Fire safety. A nurse sees smoke coming from a client's room. The nurse's first action should be to 1. Call the fire department immediately. 2. Pull the nearest fire alarm. 3. Close the doors to the client rooms. 4. Move the clients away from the fire. The correct answer is 4. Move the clients away from the fire. Rationale. The mnemonic for fire safety is RACE, rescue, alarm, confine, extinguish. The very first step is rescue. Move clients and others away from the immediate area of danger. Incorrect options 1 and 2. Calling the fire department and pulling the alarm is the second step, alarm. 3. Closing the doors is the third step, confine. Clinique RN test day tip. Remember RACE for fire safety. Rescue, alarm, confine, extinguish. Your first priority in any safety scenario is the protection of life. Question 9. Anticoagulant administration. A nurse is preparing to administer enoxaparin, Lovenox, subcutaneously. Which action by the nurse is correct? 1. Aspirate after inserting the needle to check for blood return. 2. Rub the injection site for 10 seconds after administration. 3. Inject the medication into the subcutaneous fat of the abdomen. 4. Expel the air bubble from the pre-filled syringe before injection. The correct answer is 3. Inject the medication into the subcutaneous fat of the abdomen. Rationale. Enoxaparin is a low molecular weight heparin, LMWH, that should be injected into the subcutaneous fat of the right or left abdominal wall, at least 2 inches from the umbilicus. Incorrect options. 1. Aspiration is contraindicated as it can increase the risk of bleeding or hematoma formation. 2. Rubbing the site is contraindicated as it can increase the risk of bruising and bleeding. For the air bubble in the pre-filled syringe must not be expelled as it is designed to push the medication deep into the tissue, ensuring full dose delivery and sealing the injection tract. Clinique RN test day tip. For all LMWH, like Lovenox, remember the 3 no's. No aspiration, no rubbing, and no air bubble expulsion. Question 10. Antidote knowledge. A client is experiencing severe signs of opioid toxicity, RR6 per minute, unresponsive. The nurse administers naloxone, Narcan. The nurse understands that the highest priority after administering the dose is to 1. Document the client's current pain level. 2. Assess the client for signs of withdrawal. 3. Prepare to administer a second dose. 4. Place the client on NPO status. The correct answer is 3. Prepare to administer a second dose. Rationale. Naloxone has a much shorter half-life than most opioids. Once the naloxone wears off, the client can quickly revert to respiratory depression. The nurse must be prepared to administer a second dose to maintain the therapeutic effect and prevent recurrence of respiratory failure. Incorrect options 1 and 2. Assessing for pain or withdrawal are secondary to ensuring a stable respiratory status. NPO status may be appropriate for an unresponsive client, but it is not the immediate, highest priority action after administering the antidote. Clinique RN test day tip. The Nclex often tests the short half-life principle for antidotes like naloxone and flumazenol. Always anticipate the need for repeat dosing. Question 11. Medication adverse effect. A client is prescribed vancomycin IV for a severe infection. Which finding should the nurse report to the healthcare provider immediately? 1. Mild pruritus and flushing of the face and neck. 2. Urine output of 25 milliliters per hour over the last 4 hours. 3. Complaint of pain at the IV insertion site. 4. Through a drug level of 15 micrograms per milliliter. The correct answer is 2. Urine output of 25 milliliters per HR over the last 4 hours. Rationale. Vancomycin is highly nephrotoxic, toxic to the kidneys. A urine output of 25 milliliters per hour, below the critical 30 milliliters per hour, indicates acute kidney injury, AKI, which is a serious, life-threatening adverse effect that requires immediate intervention. Incorrect options. 1. This describes red man syndrome, which is caused by a rapid infusion of vancomycin. The nurse would simply slow the infusion rate. It is not an immediate life threat like AKI. 3. Pain at the IV site requires assessment, but is not a systemic life threat. For a trough level of 15 micrograms per milliliter is within the therapeutic range, typically 10 to 20 micrograms per milliliter. Clinique RN test day tip. For all aminoglycosides and vancomycin, prioritize assessment for nephrotoxicity, high creatinine, low urine output, and ototoxicity, ringing in the ears. Question 12. Herbal interaction. The nurse is providing discharge teaching to a client prescribed warfarin, Coumadin, for atrial fibrillation. The nurse should instruct the client to avoid which herbal supplement? 1. Echinacea. 2. St. John's wort. 3. Saw palmetto. 4. Ginger. The correct answer is 2. St. John's wort. Rationale. St. John's wort is a powerful inducer of the cytochrome P450 enzyme system, which rapidly metabolizes warfarin. This increased metabolism can lead to subtherapeutic warfarin levels, making the blood clot more easily and increasing the risk of stroke or thrombosis. Incorrect options. 1, 3, and 4. While ginger, which is 4, can slightly increase bleeding risk, St. John's wort, 2, has a significant drug-enzyme interaction that drastically reduces warfarin's effectiveness, making it the highest priority teaching point. Clinique RN test day tip. When anticoagulants, warfarin, heparin, are involved, look for any herbals that start with G, garlic, ginger, ginseng, or St. John's wort, as they are the most common interactions.
All right, quick break, because I need to show you something that can actually change the way you study for the Nclex. This is our AI feedback system, built right into the QBank dashboard. After every quiz, you don't just get a score. You get personalized insights that explain why you miss questions, where your weak spots are, and how to fix them. For example, it tells you things like which subject areas need urgent review, whether you're rushing through questions and leaving test time unused, step-by-step recommendations like taking focus quizzes to sharpen delegation, prioritization, or clinical judgment. Instead of just saying, you scored 60%, it literally gives you a roadmap to improve. And that's just one part of the QBank. You'll also get challenging Nclex-style questions that test real critical thinking, a clean summary sheet that tracks your progress over time, and a built-in computer adaptive test system so you can practice under real exam conditions. This isn't just question practice. It's smart, AI-driven coaching that helps you study smarter, not harder. If you're serious about passing the Nclex on the first try, check the link in the description and start using the QBank today.
Question 13. Medication administration and assessment. A nurse is preparing to administer digoxin to an infant with heart failure. The nurse notes the infant's apical pulse rate is 88 beats per min. The nurse should 1. Administer the dose as ordered. 2. Hold the dose and notify the provider. 3. Hold the dose and recheck the pulse in 30 minutes. 4. Administer the dose and recheck the pulse immediately after. The correct answer is 2. Hold the dose and notify the provider. Rationale. The safe lower limit for administering digoxin to an infant is typically 90 to 110 beats per min, depending on the institution, but usually above 90. A pulse of 88 beats per min indicates bradycardia and potential digoxin toxicity, making it necessary to hold the dose and notify the provider immediately for further instructions and potential lab work. Incorrect options. 1. Administering the dose could lead to further bradycardia and cardiac arrest. 3. Waiting 30 minutes delays necessary reporting and intervention for a critical condition. 4. Administering the dose is unsafe. Clinique RN test day tip. For digoxin, know the age-specific parameters. Hold for adults if HR is less than 60. Hold for children if HR is less than 70. Hold for infants if HR is less than 90, or facility policy. Question 14. Therapeutic effect. A client is prescribed levothyroxine, Synthroid, for hypothyroidism. The nurse knows the medication is having the desired therapeutic effect when the client reports. 1. A decrease in appetite and weight loss. 2. An increase in energy and less fatigue. 3. Increased frequency of bowel movements. 4. A decrease in resting heart rate. The correct answer is 2. An increase in energy and less fatigue. Rationale. Hypothyroidism is characterized by a slowed metabolism, leading to symptoms like fatigue, lethargy, and cold intolerance. Levothyroxine works by replacing thyroid hormones to increase the metabolic rate. The desired therapeutic effect is a return to normal energy levels and the resolution of fatigue. Incorrect options. 1. A decrease in appetite and weight loss are signs of a return to normal metabolism, but the primary subjective therapeutic effect the client reports is increased energy. 3. Constipation is a symptom of hypothyroidism, so increased bowel movements are desired, but increased energy is the broader therapeutic goal. 4. Levothyroxine increases the heart rate. A decrease in HR would indicate an adverse effect or a need for a dose change. Clinique RN test day tip. The desired therapeutic effect is the opposite of the disease symptoms. If the disease causes slow and low symptoms, the drug should cause normal and energetic effects. Question 15. Acute kidney injury, AKI. The nurse is caring for a client with a history of heart failure and AKI. The client's morning potassium level is 6.5 milliequivalent per liter. The nurse should anticipate an order for 1. Furosemide IV push. 2. Spironolactone PO. 3. Regular insulin IV with 50% dextrose. 4. Digoxin PO. The correct answer is 3. Regular insulin IV with 50% dextrose. Rationale. A potassium level of 6.5 milliequivalent per liter is critically high. Hyperkalemia. The fastest way to temporarily shift potassium out of the bloodstream and into the cells is by administering a hypertonic solution of dextrose to prevent hypoglycemia combined with regular insulin, which forces potassium into the cells. Incorrect options. 1. Furosemide, a loop diuretic, removes potassium, but its effect is slower and less immediate than the insulin or dextrose method for a critical level. 2. Spironolactone is a potassium-sparing diuretic, which would worsen the hyperkalemia. 4. Digoxin is contraindicated in hyperkalemia as it increases the risk of digoxin toxicity and life-threatening arrhythmias. Clinique RN test day tip. A critical lab value requires a critical, immediate intervention. Remember that cation treatment for hyperkalemia, calcium gluconate, protects heart, adenosine, sometimes used, treatment with insulin or dextrose, IV fluids, other meds like K-exolate, nitrates/bicarb. Question 16. COPD teaching. The nurse is teaching a client with COPD about the benefits of pursed lip breathing. The nurse explains that this technique primarily helps to 1. Prevent carbon dioxide retention. 2. Increase the oxygen-carrying capacity of the blood. 3. Strengthen the diaphragm muscle. 4. Promote nasal breathing over mouth breathing. The correct answer, 1. Prevent carbon dioxide retention. Rationale. Pursed lip breathing creates back pressure in the airways during exhalation. This prevents the small airways, bronchioles, from prematurely collapsing, allowing for more complete exhalation of trapped air, thus preventing CO2 retention and minimizing air trapping. 2. The technique does not affect the oxygen-carrying capacity of hemoglobin. 3. Diaphragmatic breathing strengthens the diaphragm. Pursed lip breathing addresses airflow dynamics. For this is a side effect of the technique, not its primary therapeutic purpose. Clinique RN Test Day Tip. For COPD questions, always focus on the primary problem, air trapping and CO2 retention. Interventions should aim to get air out of the lungs. Question 17. Postoperative complication. A client who is 3 days postoperative from a hip replacement reports sudden shortness of breath, chest pain, and a feeling of impending doom. The nurse's first action is to 1. Administer the prescribed PRN pain medication. 2. Apply oxygen via a non-rebreather mask. 3. Call the healthcare provider immediately. 4. Reposition the client into a high Fowler's position. The correct answer is 2. Apply oxygen via a non-rebreather mask. Rationale. The client's symptoms, SOB, chest pain, impending doom, are classic for a pulmonary embolism, PE, a life-threatening, acute breathing problem. The first action must be to stabilize the client's oxygenation by applying the highest concentration of oxygen available, non-rebreather mask, before calling for help. Incorrect options. 1. Pain medication will not help the breathing problem and may cause respiratory depression. 3. The nurse should stabilize the client, ABC, first, then call the provider. 4. Repositioning is helpful, but administering oxygen is the direct, life-saving intervention. Clinique RN Test Day Tip. When faced with a suspected PE or cardiac event, the sequencing is always stabilize breathing or circulation, oxygen, positioning, fluids, then call for help, provider or rapid response. Finally, prepare interventions. Question 18. Diabetes mellitus. The nurse is teaching an adolescent client with newly diagnosed type 1 diabetes mellitus about the Samajai effect. The nurse should explain that this phenomenon is characterized by 1. High blood glucose levels in the morning due to insufficient morning insulin. 2. Rebound morning hyperglycemia following an episode of nocturnal hypoglycemia. 3. Elevated blood glucose throughout the night due to growth hormone release. 4. Hypoglycemia occurring 2 to 4 hours after eating due to delayed gastric emptying. The correct answer is 2. Rebound morning hyperglycemia following an episode of nocturnal hypoglycemia. Rationale. The Samajai effect, or rebound hyperglycemia, occurs when an overdose of insulin at night causes a rapid drop in blood glucose, hypoglycemia, during the night. The body responds by releasing counter-regulatory hormones, glucagon, epinephrine, leading to rebound hyperglycemia in the morning. Incorrect options. 1. This describes a simple dosing error. 3. This describes the dawn phenomenon, which is an increase in blood glucose due to the early morning release of growth hormone and cortisol. For this is not a recognized effect of type 1 diabetes. Delayed gastric emptying, gastroparesis, can occur but does not fit this description. Clinique RN Test Day Tip. Nclex frequently contrasts the Samajai effect and the dawn phenomenon. To differentiate, tell the client to check blood glucose levels at 2 to 3 a.m. to see if they are low, Samajai, or high/normal. Question 19. Tube feeding safety. The nurse is preparing to administer a continuous enteral feeding to a client via a nasogastric (NG) tube. The nurse aspirates 150 milliliters of gastric residual volume, GRV. The nurse's next action should be to 1. Hold the feeding and notify the healthcare provider immediately. 2. Return the residual to the stomach and continue the feeding. 3. Discard the residual and decrease the feeding rate by half. 4. Return the residual to the stomach. Hold the feeding for 1 hour, then recheck. The correct answer is 2. Return the residual to the stomach and continue the feeding. Rationale. Current evidence-based guidelines from the American Association of Critical Care Nurses, ACN, state that the critical threshold for holding a feeding is generally a GRV of 500 milliliters or more. Since 150 milliliters is well below the critical threshold, the nurse should return the residual to prevent metabolic alkalosis/electrolyte loss and continue the feeding. Incorrect options. 1. Holding the feeding is unnecessary and interrupts nutrition. 3. Discarding the residual is incorrect as it causes a loss of electrolytes and gastric acid. 4. Holding the feeding is unnecessary as the volume is low. Clinique RN Test Day Tip. Nclex questions often use older guidelines, which were 100 to 200 milliliters. Always answer based on current evidence. Only hold the feeding if the residual volume is greater than or equal to 500 milliliters or if the client shows signs of intolerance, vomiting, abdominal distension. Question 20. Stroke management. The nurse is teaching the family of a client with right-sided hemiparesis due to a stroke. The nurse should recommend placing the bedside table on the client's 1. Left side. 2. Right side. 3. Opposite the side of the door. 4. On a height that requires reaching. The correct answer is 1. Left side. Rationale. The client has right-sided hemiparesis, weakness, or paralysis, which means their left side is the strong side. Objects and support should always be placed on the strong, unaffected side to allow the client to actively participate in their care, promoting independence and preventing injury. Incorrect options. 2. Placing items on the weak side increases the risk of falls and injury and prevents independent access. 3 and 4. These options are irrelevant to the client's motor deficit. Clinique RN Test Day Tip. For stroke or injury care, assume the client is a fall risk. Always place essential items, call bell, water, phone, table, on the client's strong, unaffected side. Question 21. Gastric ulcer pain. A client with a history of peptic ulcer disease reports frequent, severe epigastric pain that usually occurs about 30 to 60 minutes after eating. The nurse suspects the client has which type of ulcer? 1. Gastric ulcer. 2. Duodenal ulcer. 3. Esophageal ulcer. 4. Stress ulcer. The correct answer is 1. Gastric ulcer. Rationale. Pain from a gastric ulcer is typically described as a burning or gnawing sensation that occurs soon after eating, 30 to 60 minutes, because the food is irritating the ulcerated stomach lining. Incorrect options. 2. Pain from a duodenal ulcer typically occurs later, 2 to 3 hours after eating, and is often relieved by eating food, as the food buffers the acid before it reaches the duodenum. 3 and 4. Esophageal ulcers are associated with GERD, and stress ulcers are common in critically ill clients. The timing of the pain fits the gastric ulcer pattern. Clinique RN Test Day Tip. To differentiate gastric versus duodenal ulcers, gastric pain is high, gets worse with food. Duodenal pain is deep, doesn't hurt with food, relief. Question 22. Therapeutic communication. A client newly diagnosed with cancer states, I know I have to start chemo soon, but I'm worried my children won't recognize me when my hair falls out. The nurse's most appropriate response is 1. Don't worry, many people feel that way, but your hair will grow back. 2. Have you thought about buying a wig or a hat? 3. It sounds like you are concerned about your appearance and how your children will react. 4. You should focus on getting well. Your appearance is less important right now. The correct answer is 3. It sounds like you are concerned about your appearance and how your children will react. Rationale. This response uses the therapeutic communication technique of reflection/restatement. It acknowledges and validates the client's feelings and concerns, worried, appearance, children, without offering false reassurance or minimizing their feelings. This invites the client to elaborate. Incorrect options. 1. 4. For these, minimize the client's feelings and offer false reassurance or judgment. Don't worry. Focus on getting well. 2. This offers premature advice and blocks further communication about the client's emotional state. Clinique RN Test A tip. For therapeutic communication, always choose the response that 1. Focuses on the client's feelings, not facts. 2. Avoids giving advice. 3. Avoids why questions. Question 23. Postpartum hemorrhage. The nurse is assessing a client 1 hour postpartum who has saturated a perineal pad in 15 minutes. The nurse notes the client's fundus is boggy and displaced to the right. The nurse's first action is to 1. Notify the healthcare provider of the findings. 2. Administer an ordered 4 bolus of oxytocin. 3. Massage the fundus firmly until it is firm. 4. Obtain a complete set of vital signs. The correct answer. 3. Massage the fundus firmly until it is firm. Rationale. The client is at high risk for postpartum hemorrhage, PPH. A boggy, uncontracted fundus is the primary cause of PPH. The nurse's first and most critical independent action is to manually massage the fundus to stimulate contractions and reduce bleeding. Incorrect options. 1, 2, 4. For all other options are necessary but are performed after the fundus has been massaged, routinely. Massage then, get vitals, empty bladder, administer oxytocin, and notify provider. Clinique RN Test A tip. Postpartum hemorrhage priority is always to treat the underlying cause. Fundal massage is the immediate, non-invasive treatment for uterine atony, boggy fundus. Question 24. Preterm labor drug. The nurse is administering an infusion of magnesium sulfate to a client in preterm labor. The nurse notes the client's respiratory rate is 10 breaths per minute, and deep tendon reflexes are absent. The nurse should immediately prepare to administer 1. Oxytocin. 2. Naloxone. 3. Calcium gluconate. 4. Terbutaline. The correct answer is 3. Calcium gluconate. Rationale. The client is showing signs of magnesium toxicity, respiratory rate less than 12 per minute, and absent deep tendon reflexes. Calcium gluconate is the specific antidote for magnesium toxicity and must be administered immediately to prevent respiratory or cardiac arrest. Incorrect options. 1. Oxytocin causes uterine contractions and is used to induce labor, not to reverse magnesium toxicity. 2. Naloxone is the antidote for opioid overdose. 4. Terbutaline is a tocolytic, stops contractions, but is not the antidote for magnesium toxicity. Clinique RN Test A tip. Know the classic antidotes. Magnesium sulfate toxicity to calcium gluconate. Question 25. Preeclampsia assessment. The nurse is caring for a pregnant client with severe preeclampsia. Which assessment finding is most indicative of the client developing HELLP syndrome? 1. Fetal heart rate is 130 beats per minute with moderate variability. 2. Platelet count of 90,000 cells per milliliter. 3. Blood pressure of 145/95 mmHg. 4. 3+ pitting edema of the lower extremities. Correct answer. 2. Platelet count of 90,000 cells per milliliter. Rationale. HELLP syndrome is a severe complication of preeclampsia, defined by hemolysis, elevated liver enzymes, and low platelets. A platelet count of 90,000 per milliliter cube. Normal, 150,000 to 400,000 per milliliter cube, is critically low and a key diagnostic component of HELLP syndrome. Incorrect options. 1. The fetal heart rate is normal and reassuring. 3. The blood pressure is elevated but not indicative of HELLP. Severe preeclampsia is typically greater than or equal to 160 over greater than or equal to 110 millimeters of mercury. 4. Edema is a common finding in preeclampsia but is not specific to HELLP syndrome. Clinique RN Test A tip. When a maternal client is critical, think of the HELLP mnemonic. Hemolysis, elevated liver enzymes, low platelets. Question 26. Developmental milestone. The nurse is assessing a 4-year-old client during a well-child visit. Which finding is a primary indicator that the child is meeting expected gross motor milestones? 1. The child can tie his own shoelaces. 2. The child can hop on one foot. 3. The child can draw a person with 6 parts. 4. The child can copy a diamond shape. The correct answer is 2. The child can hop on one foot. Rationale. Gross motor skills for a 4-year-old include hopping on one foot, throwing a ball overhand, and walking up and down stairs without support. Incorrect options. 1. Tying shoelaces is a fine motor skill, usually achieved around 5 to 6 years. 3. Drawing a person with 6 parts, head, eyes, nose, mouth, body, legs, is a fine motor/cognitive milestone achieved around 5 years. 4. Copying a diamond shape is a fine motor skill achieved around 6 years. Clinique RN Test Day Tip. Know the key milestones for age 4. Gross motor is giant steps, hopping, skipping. Fine motor is finger dexterity, drawing a square, using scissors. Question 27. Cast care priority. A child is admitted with a new cast on the left arm. Which assessment finding is the most critical to report to the provider immediately? 1. The child reports a pain level of 5/10. 2. The child is unable to move the fingers of the left hand. 3. The left hand is cooler to the touch than the right hand. 4. The cast is slightly damp from the drying process. The correct answer is 2. The child is unable to move the fingers of the left hand. Rationale. The inability to move the fingers, paresis or paralysis, is a sign of nerve damage or severe pressure. This is a critical symptom of compartment syndrome, a life-threatening complication where swelling inside the cast cuts off circulation and nerve function. Incorrect options. 1 and 3. Pain and coolness are also signs of compartment syndrome, but paralysis, loss of motor function, is the most advanced and irreversible symptom, making it the highest priority. 4. A slightly damp cast is expected during the drying process. Clinique RN Test Day Tip. For cast complications, look for the 6 Ps. Pain, severe, paresthesia, tingling or numbness, pallor, pale, paralysis, inability to move, pulselessness, late sign, and poikilothermia, coolness. Paralysis is the most ominous sign. Question 28. Autism spectrum disorder. The nurse is preparing to care for a 6-year-old child with autism spectrum disorder, ASD. Which intervention should the nurse prioritize to minimize anxiety? 1. Maintain a brightly lit room and allow the child to play with a variety of toys. 2. Introduce all healthcare personnel at the beginning of the shift. 3. Provide a structured daily schedule and use consistent care routines. 4. Encourage the child to make eye contact and engage in reciprocal conversation. The correct answer is 3. Provide a structured daily schedule and use consistent care routines. Rationale. Clients with ASD thrive on predictability and routine. Changes in the environment or schedule cause extreme anxiety. Providing a structured, consistent schedule minimizes sensory overload and increases the child's feeling of safety and control. Incorrect options. 1. Bright lights and excessive toys can increase sensory stimulation, which is a major source of anxiety for a child with ASD. 2. Introducing many new people at once can be overwhelming and anxiety-inducing. 4. Enforcing eye contact and reciprocal conversation is a common challenge for children with ASD and can increase distress. Clinique RN Test Day Tip. For autism spectrum disorder, your key intervention is to reduce stimuli and enforce routine/predictability. Question 29. Anxiety disorder interventions. A client with severe anxiety is admitted to the psychiatric unit. The client is pacing rapidly and is unable to sit still. The nurse's priority intervention is to 1. Teach the client deep breathing exercises. 2. Escort the client to a quiet, solitary room. 3. Administer the prescribed PRN anxiolytic medication. 4. Attempt to identify the source of the anxiety. The correct answer is 3. Administer the prescribed PRN anxiolytic medication. Rationale. The client is in a state of severe anxiety, demonstrated by rapid pacing and inability to sit still. This level of anxiety prevents the client from engaging in coping mechanisms like deep breathing or rational conversation. The priority is to reduce the anxiety level rapidly using the PRN anxiolytic to prevent escalation into panic or violence. Incorrect options: 1, 2, and 4. Deep breathing, identifying the source, and quiet room are interventions for mild to moderate anxiety. In a severe state, the client is incapable of processing information or self-soothing. Clinique RN Test Day Tip. For severe or panic-level anxiety, the client's cognitive and coping abilities are lost. Your priority is immediate chemical stabilization medication to bring the client back to a level where they can learn or talk. Question 30. Abuse recognition. The nurse is conducting a health history for an elderly client who lives with their son. Which finding is the most suspicious indicator of potential elder abuse? 1. The client frequently interrupts the son during the interview. 2. The client has a poor appetite and has lost 5 pounds in the last month. 3. The son insists on answering all questions directed to the client. 4. The client has signs of mild dehydration and dry mucous membranes. The correct answer is 3. The son insists on answering all questions directed to the client. Rationale. The son's insistence on answering all questions and refusal to allow the client to speak is a classic sign of isolation and control, which are behaviors frequently seen in perpetrators of elder abuse, physical, financial, or psychological. This action immediately raises a red flag. Incorrect options. 1. Frequent interruption may be a sign of cognitive decline or anxiety. 2 and 4. Poor appetite, weight loss, and dehydration are common symptoms of many medical conditions, example, depression, disease progression, and are less specific indicators of abuse than controlling behavior. Clinique RN Test Day Tip. Suspecting abuse, child, partner, or elder, requires an assessment of behavior and control. The most concerning signs are controlling actions, reluctance to speak alone, or injuries inconsistent with the story. The nurse is a mandated reporter. So how did you do? Did you pass? Don't stop here. Click the link at the top corner to take our free daily Nclex test and keep pushing yourself closer to passing. And if this helped you, make sure to like, comment, and subscribe so you never miss the next challenge.